Hello, I'm here with Karina Gould. She's the Parliamentary Secretary to the Minister of International Development at La Francophonie. Thanks so much for joining me today.
Yeah, my pleasure.
So we're going to talk about resilient and responsive health systems. What actions do you think must be taken to make our health systems more resilient and more responsive?
Well, there's lots that needs to be done to make our health systems as resilient as possible. When we think about resilience, we think about having well-trained healthcare professionals. We think about having good logistic systems to make sure that we're getting medicines and supplies to remote communities or just to general communities. We also need to think about the data that we're collecting. We need to think about all of those pieces that makes a system complete, and that when there are challenges and when there are crises, that make sure that that system is strong enough that it can not break under the pressure and that can continue to provide the healthcare and the services that citizens around the world expect of it and require to make sure that they can continue to live healthy and fulfilled lives.
Can you talk to me about what Canada is doing in these areas?
Health is a big priority for Canada. Over the past decade, we've put a lot into particularly maternal, newborn, child, and adolescent health. But one of the things that we know, and one of the areas where Canada is working a lot, is in data collection and building data systems. So if you think about it, here in Canada, when you're born, you're registered, right? And you have your birth certificate. Your birth certificate then allows you to go to school, it allows you to get a health card, it allows you to register to vote and get a driver's license. And so that piece of identity is really important to be able to access systems. But that doesn't happen everywhere in the world. So one of the priorities for us as a government is investing in civil registry and vital statistics programs and systems around the world to help build that database so that countries can then plan accordingly to know where they have pain points in their health system, where they're doing well, and to make sure that they're providing services to the people and to the spaces that need it the most. And so that's one area that we're working in. But in others, we have some great training programs and capacity building through Canadian NGOs and partners around the world that are helping to strengthen health professionals, but also to understand how to use that data that they're then collecting to make effective systems to provide those services.
And what are the main countries that Canada is kind of working in, especially when it comes to this data collection?
So we work through the Global Financing Facility. We've provided, I believe, about $100 million to the GFF, which is kind of the global body that is helping these countries. So we don't decide precisely where that money goes, but we're really doing it in a global effort to ensure that all countries around the world, and by virtue all of their citizens, have access to this identity, which will enable them to have access to those services.
Right, yeah, that makes sense. And you've talked a little bit about the role that research evidence plays when we're talking about Canada and its partners building these health systems. Is there anything else you want to add on that or elaborate on?
I think what's really important, and something that I've heard a lot over the past year in this role, is the importance of community-based research and community-based evidence. And so what I mean by that is making sure that researchers are remembering the people that they're looking into research and designing systems for, and making sure that their needs and their diverse perspectives are included in building those systems. Because the worst thing that can happen is that you create this wonderful system that works in theory, but that doesn't actually provide the health services that are needed on the ground. And so I think it's wonderful, all the research that's going on. I think it's great, all of the people that are participating in this conference and really doing that macro level understanding, but making sure that we constantly bring it back down to the micro to ensure that the people who we are aiming to serve and the people who we are aiming to support can access those services as best as possible.
Well, thanks so much for joining me.
Yeah, my pleasure. Thanks so much.